Why is it important to verify patient insurance? Identity theft. This can literally kill you if someone steals your medical identity. I am a 50-year-old female and went in for a random endocrinologist appointment. When I checked in, Sarah threw me side-eye and wrote down, "Don't answer to your name." This was creepy, but I said, "Cool." Shortly they called my name and a young woman stood up and said, "Grandmother, that's you." No, I'm not 87 or so, or wheelchair bound. WTF. Data breach of my insurance company. The family seeking care for grandmother, well, they got escorted to the and my files were locked down. I still hip deep in legal, criminal stuff. Grandma had uncontrolled diabetes, I'm hypoglycemic. Grandma was 5 feet 4 inches and 210 pounds, I'm 5 feet 11 inches and 110 pounds. A screw up on medical records could have killed each of us. I've also got blood cancer, lung cancer and adrenal gland tumors, so my files would kill grandmother with my treatment and her expected diabetic amputation would screw mine, so don't be offended by insurance verification or them demanding a state-issued ID. Because the doctor will likely not get paid if the office accepts a patient who turns out not to have coverage. People who don't have insurance are usually struggling, and lots of times they're illegals who can't get coverage. So if you work in the doctor's office and it is your job to verify coverage, you may cost the doctor lots of money if you accept any uninsured patients. The only exception would be an uninsured patient who offers to pay cash. The doctor may offer a cash price for services that still allows him or her to make money from treating an uninsured. To me, it doesn't matter. I never once asked someone how they would pay. It had no bearing. By law I could not refuse anyone, so why bother asking? In a country with universal health care, almost no one is covered. The odd visitor that is not covered is not going to break the system. If someone needs care, it is the last thing on my mind. So there are no surprises, not for the patient and not for the doctor. Besides, I never enjoyed signing the dunning letters to make sure that the provider or doctor gets paid for their services. If not, then patients would be seen and no one would be paid, causing business to lose money or go out of business.